Okay, let's start over. So, welcome to the Honey and Harry show. I'm Honey, and Dad is.
And I think I'm Harry, but I'm not sure today. Okay.
We had a little. We're always having trouble with sound every once in a while. So, anyways, today's guest is Dr. Leah Larson. Welcome to the show.
Thank you.
We had Dr. Wilbanks, Erin, who is my niece. She was on and really discussed the whole holistic side of dentistry, and this is my dentist, and you do the more, oh gosh, now I forgot, conventional dentistry. So really love Dr. Larson. She takes care of me, and I'm trouble with the mouth. I am trouble. I'm super anxious, and she takes care of Lindsay, who my daughter had cancer, and once you have chemo, there's all kind of problems with your mouth that can occur. So she takes great care of her, my husband. And like I said earlier, which we were on, I called her one Saturday and I was having just a meltdown, and she called me back, and I was really, really concerned about Lindsay, and she answered all the questions so I could just relax for the weekend, which so grateful you did that day. I'll never forget that. So, welcome to the show.
Thank you. Thank you so much for having me.
So today, let's start by talking about traditional dentistry and what all that entails.
Well, so I was really impressed listening to Dr. Erin Wilbanks. I am not a holistic dentist. I am a conventional dentist. But I'm always open to learning new things.
Absolutely.
And it was really neat to hear the holistic side of dentistry. And I know of like certain things. I know that you guys talked about implants. Well, I know that they don't use titanium implants. They use ceramic implants. And I know that because I saw a holistic dentist lecturing about ceramic implants at the International Congress of Oral Implantologists. So that was kind of like a beginning. I was like, ceramic, what?
Yeah.
So anyway, and then you guys talked about sealants, fluoride, also breathing through your nose, like sleep apnea.
And that actually helped Dad. Didn't that work? This breathing through your nose, Dad?
The first night I tried it, my nose was clear enough that it worked, and I didn't even have to tape my mouth. However, my nose is a bad thing, so it just gets messed up a lot, and I can't breathe. And I'm not going to tape my mouth if I can't breathe.
Yeah.
I actually didn't realize that people tape their mouth to breathe.
Really?
But I do. Being a conventional dentist, I didn't know if it kind of sounded like, well, your conventional dentist doesn't really care about this. It's your holistic dentist. And that really isn't true. With conventional dentistry and holistic dentistry, they do overlap. I see a lot of patients that, especially since COVID, it was amazing how many people were breaking their teeth from clenching and grinding. Why do people clench and grind? Stress, the anxiety of the unknown. And we also saw a lot of other sequelae or other consequences as a result of the clenching and grinding, or just the stress. Well, I know that because I see so many patients that are stressed and that clench and grind, and we see so many, I want to know more about clenching and grinding and how do I really help these patients? Because when you're in pain and when you have pain in your head, it is very, very miserable.
I've been there. You know that.
Absolutely.
Until the dog ate it.
And that's the most expensive dog toy. But one thing I found,
but it helps my headaches. It
absolutely
does, and it helps actually. My mouth swells. I get fatter on one side
because of the muscles are spasming, and it's just like going to the gym and you're working out your muscles. Those muscles the muscle fibers are starting to expand, and that's what happens. Like some people that are big clencher and grinders, they have really big jowls, they have big muscles.
Yeah.
But the other thing that I found that was related to the clenching and grinding is sleep apnea. And that was one thing that Dr. Wilbanks was talking about, was a lot about your sleep, tongue tie, the adenoids, the sunken in bags around children's eyes.
No, and that is.
And, you know, as a dentist and even as a conventional dentist, we're kind of like the first line of that, like the physician's in your mouth for a little bit, and there's some telltale signs. But what we found is that people that have sleep apnea, they try to compensate for the fact that they're not getting air at night, and they'll start clenching and grinding. And so so I actually learned a lot about sleep apnea, to the fact that when I was done with this, and it was a pretty intense course, we had medical doctors, sleep specialists, because it was a combination of dentists and physicians. I went home and I told my husband, I think you have sleep apnea. Now, as a dentist, I can't diagnose that, but you work closely or you recommend to a physician, because you're really supposed to really breathe with your mouth as much as you're supposed to eat with your nose. So
that's so weird.
That's why it makes sense why people are taping their mouth together, because it's forcing them to breathe through their nose. Your nose actually produces, naturally, they've been finding through research, nitric oxide. Nitric oxide is the same thing when some dentists, they have laughing gas.
Yeah.
That's nitric oxide. Well, it has some really good overall healing properties for your body. And that's why, and then the other thing is that your nose, that is one of the first defense mechanisms of filtering. It's an air filtration, right? Of getting that air down up into the lungs. So there's a lot of really great benefits with nose breathing. But I didn't realize it was coming down to the point where people were taping their mouth. And then the tape was now being suggested for facial hair. And I'm like, fascinating. So that was a really good point that, Dr. Wilbanks brought up. I thought that was great. So, I had a patient that was mouth breathing just this week. And I'm like, sir, you need to go to the ear, nose, and throat doctor. You got to get your nasal passages looked at. And I'm like, I think you might have sleep apnea. Oh, yeah, I got sleep apnea. And I'm like, okay, are you wearing your machine? Oh, no. I'm like, well, they got different masks now. And that's another thing. If you have a CPAP machine and a night guard, that sometimes becomes an issue too.
Oh, I'm sure.
So not to just, focus on that subject, but airway, sleeping is very, very important.
It's huge though. And it's like I come in all the time, I feel like. But I'm always like, I have an emergency. They're like, there's nothing wrong with her, but we letting her come today. But like I had something on my throat and my doctor was like, I don't know. They weren't sure. So I came to my dentist because y'all are the mouth experts. And it was just, and it wasn't an ulcer. It was just like, I don't know what it was, but whatever it was, you were like, it's going to be gone in a couple of days. If it's not, come back. And it was gone in a couple of days, so that it is so important to see your dentist. A lot of people like me, I avoided going to the dentist for a while, and it's just so crucial. It's so crucial for your health.
Yeah.
I mean, it can affect your heart.
So I kind of think of going to the dentist, doing your 6-month checkup.
Yeah.
It's like getting your oil changed for your car.
Okay.
Because the problem is if you don't bring your car in when it needs an oil change, it's going to need an overhaul. And when it's an overhaul, it's extremely expensive. You're
so
changing
expensive.
multiple things on your car. Well, same thing in the mouth. You wait until you have pain. That's not going to be a fun visit. And you're going to hate us.
I know, yeah. And that's why every day when I take a sip of anything, I'm going to make sure it hurts. I'm so crazy. I just want to make sure I don't have any problem because I don't want to go through anything. And not that y'all have done anything terrible.
No.
Y'all have always taken great care of me, always. But it is such an anxiety that people have.
Absolutely, because it's the loss of control.
Yeah, but I do want to talk about so and I know I'm not trying to talk about myself a lot. I'm going to talk, and this is it, about I had a fall. I fell couple weeks ago, and I chipped my tooth, and I hit my jaw on like a dirt bike, and I wasn't riding, and I just tripped over it. and my mouth was tore up in the inside, and she's getting ready to, she's gonna fix my teeth. It's no big deal, but like it's so important. I didn't go to you right away.
Which we would recommend.
Thank you. And that's what, a lot of people were telling me, you have got to get your teeth checked because what if something, and then we did come to find out I have some damage on my teeth. So I'm glad I came in. So don't ever, like, when you're falling, just go to your dentist, don't not go because you're scared. Because that was my biggest fear. I was just scared, not, that's why I didn't come.
Well,
Yeah.
and we can be scary because we're going to tell you sometimes things that you don't like.
That you don't want to hear. Absolutely.
Yeah.
So, anyways, are there some ways, and this is the smile, that you can improve your smile that's not so expensive? Because some people, and like for me, like I have really sensitive teeth. So I'm not going to whiten my teeth with a whitening thing. What's maybe a good whitener to use that's not maybe like is it a laser they do now? What is it?
Ooh, well, you may not necessarily like my suggestion.
Oh, shoot.
But a really easy way,
Mm-hmm.
I really like Listerine whitening,
Uh-huh.
like the mouth rinse. Has
Really?
fluoride. I'm your conventional dentist.
Okay.
I do believe in fluoride.
Absolutely.
I have not seen. I have to see more studies in terms of, in regards to like the last conversation, that a lot of them were skewed in terms of the benefits of fluoride.
Mm-hmm.
I'm not convinced.
Mm-hmm.
I am convinced that fluoride helps protect your teeth against cavities.
Okay.
Now, so it has fluoride in it.
Mm-hmm.
So that's going to help strengthen your teeth from cavities.
Okay.
The other thing that it has a very small amounts of hydrogen peroxide in it. And actually, it's those oxygen bubbles that in the hydrogen that help they'll only whiten your teeth about a shade or two. Because kind of think of your teeth kind of like, and you've heard me talk about this,
Mm-hmm.
think of your teeth like a sponge.
Mm-hmm.
They have those little pores. So over time, those little pores, they're going to absorb what you eat and drink. And they're going to absorb those color molecules. So just like if you have like a sponge that you've been using to clean off something with a bunch of dirt,
Mm-hmm.
got to go rinse that little guy out and clean
Yeah.
out those little small pores, right?
No, true.
So with using like hydrogen peroxide, not straight, but like I said Listerine, but there's a lot of them on the market that
Mhm.
have the whitening with that hydrogen peroxide. And what it does, it's safe, and it has a little oxygen bubble. So when you're done with rinsing, you got little bubbles around your teeth.
Really?
Yes. And a lot of people, some people will be okay with it, other people will not. So, and in terms of, I don't know if it has alcohol in it because I don't recall it ever burning my mouth.
Okay.
But I was using that in residency, and I use it from time to time.
And your teeth are white.
Oh, well, that's really nice of you to say that.
No, but they
I
are.
need to be using it consistently because sometimes I'm too lazy to actually bleach. But the next question is, what are you bleaching with? Are you bleaching with something that is over the counter,
Mhm.
like a strip? Well, those strips, as soon as you put something in your mouth, your brain is like, oh, it's time to eat. So your brain starts producing saliva. So those things move all over.
I've
they
tried
move.
those, and they don't work.
They work for some people.
Well, they don't work for me.
And for me, they start shifting, and I'm
me
like,
too.
oh my
and I'm like
gosh.
constantly moving them,
Yes.
and then I feel like I'm swallowing bleach, and then I panic.
But the thing is that bleach is it's not very potent because it's getting all over your gums. So something that's a potent bleach, like that you would get from your dentist, as in like tubes of some really potent stuff, can't get that on your gums. It will literally burn your gums off.
Oh, wow.
So there, you talk about differences there, but I'm sure that you didn't experience any sensitivity with those whitening strips.
No.
I mean, they'll do like
They're just
they're
just
two
messy.
shades.
Yeah, they're just a mess.
They're a mess.
They're just a mess, and that's where I was like, I know people want, because I know some people go in and they get them at the dentist. They get them whitened.
They do, yes.
And why are you? So that's another question. Why are some people's? My teeth are real sensitive.
we all have different tolerances.
Really?
Yes. So I have sensitive teeth.
Really, you do too.
Mm-hmm. I can't bite into ice cream.
Isn't that weird?
And I can see other people just go bite. And then
Yeah.
when I drink water, I don't get it on my cheek side of my teeth. It hurts.
Okay. So that's yeah,
And
okay.
so we all have different sensitivities. Now the question is like, how are you going to address that? Or, for me, it's like I'm not swishing really cold water around my teeth. That
Exactly.
hurts.
You just avoid it.
I
Yeah.
avoid it. But I mean, you can use Sensodyne. That's actually a great toothpaste
Really?
with potassium nitrate. That's your
Okay.
anti-sensitivity agent.
Okay.
Um,
And that cleans just as good as the rest of the stuff.
yeah.
Okay.
And in fact, better. It has a low relative dentinal abrasivity. It's an RDA value. I know that you
I
said
don't know what that means.
relative dentinal abrasivity.
Okay.
So at one point in time, we were talking about whitening, right?
Yes.
Charcoal toothpaste. Oh, that's going to whiten up your teeth.
Really?
Oh, you didn't see the craze about charcoal toothpaste?
I'm not on that craze. I'm not.
I don't know if it's gone now, but
That's
it was
crazy.
everywhere.
Really?
And people are like, yeah, I'm brushing with charcoal toothpaste.
Oh my gosh.
And I was like, it's abrasive. What's charcoal?
Hmm.
It's like little rocks.
Messing up your teeth.
So what it does is that it literally erodes your teeth away eventually. You only have so much thickness of that outer layer known as enamel. And then once that's abraded off, eroded off, you're into the inside portion of your tooth, which is nice and soft. So you have to be really careful with some of these gimmicks to whiten teeth. Like one is, my cousin, I can't remember the name of it, but it's all over. I mean, that's what social media is about.
Yeah, no.
It's about selling stuff to you, right? So it's like this purple stuff that you put on your teeth, and then you got this light, and then,
Yes.
Yeah, that was all over.
Yeah, I saw that.
Yeah, and be like, oh, I think that whitens my teeth. Like, I don't know what that purple solution is, but that light is just dehydrating your teeth.
Oh,
So
wow.
once your teeth are dehydrated, they look really white. But then as you put your
Okay.
lips together and the saliva starts moving in around your teeth are back to being hydrated, and the shade actually goes slightly darker.
Really? Because
Yeah.
I do see some people with their teeth are so white, they almost glow.
Okay, those are the people that are they definitely bleach.
Okay, and I'm like, oh my gosh, her teeth look so good, but again, I'm also the girl that is too scared to get Botox and plastic surgery because I'm a freak, But I don't want, so I'm not signing up to bleach my like that, because I know somebody I know people that have gotten something done in the dentist office.
Oh yeah,
and
we do it,
y'all do it,
and I've done it, and I told you I have sensitive teeth,
did it?
and I was like, okay, I'm gonna do 3 rounds all in one day.
Really?
Oh boy, I had some zingers. So
Did it
just
really hurt bad?
the zingers?
No, I mean
Ooh.
oh gosh.
But no, that was after the fact. So I wasn't listening to my body. I wasn't listening to my teeth. You could technically do a customized tray.
Uh-huh.
And I say customized because
So that's what my kids did. You gave my kids that, I think.
I may
you did,
have.
because you did. I think Peanut got, either you or Dr. Fernandez did.
Yeah.
Yeah, because she had the trays in the fridge, the stuff in the fridge.
Yeah. Yep.
Yeah, you gave that to my kids. That's right.
So yeah, and you just, if you start feeling something, you take it out.
Mhm.
But I mean, the best way to really make your smile look beautiful,
Mhm.
of course, is brighten up the, the teeth, if you will. And like I said,
Mhm.
most minimal, least expensive way is doing I've even purchased the Albertsons or a generic whitening mouth rinse.
Oh wow.
So, because it's the same ingredients as the
no, it is. It is.
and so if to make, because it's so hard to get out of the grocery store these days and have something below $100. So you're looking for the best way to to cut, and it's like,
it's so
okay,
true.
these are the same ingredients, same active ingredients.
It's just,
So
yeah. Okay, so I also want to talk about too, I know you were saying how when we compare the X-rays year to year and how important it is to
Yeah.
get those X-rays. And should we be doing it every 6 months, or because I know the insurance will only pay yearly?
or actually sometimes it's 2 years. Sometimes it's every 18 months, a year
Oh,
and a half.
really?
And the American Dental Association recommends once a year.
Once a year.
Yeah.
Okay. Because I know, I mean, I know Dr. Fernandez and I think we did every 6 months for a while and then we started doing a year. So I just want to know, like, what is your recommend? And I know you said you watch, like, and that's what's so good when once you find a dentist to stick with your dentist. I think it's important to stick with your dentist because you have all my information, like for
Yep.
years. You know
Yep.
what I mean? And you can just go back and, like you were saying, you can compare to all the different X-rays. And
And the other thing is that we start to see certain trends in your mouth.
okay,
So, an X-ray of a cavity on one patient is not the same as an X-ray
really?
on another patient of a cavity.
Huh.
So it can look really small. You're like, okay, I'm gonna keep an eye on this. And then you're like, no, I can see this through the tooth, through light illumination. And then you are like, okay, we're gonna go ahead, we're gonna take care of this tooth. You have a cavity here. You open up the tooth. And I always kind of think of, treating teeth, it's kind of like doing construction in a home. I see, an X-ray is 2-dimensional, but your teeth are 3-dimensional. So
Okay.
I suspect I see something there. I can see something on the X-ray, but I'm really gonna know how big this cavity is or what kind of damage do you have behind. We can see something on your wall, but we need to break down the wall to really
Sure.
see
Okay.
what's behind it.
Not until you go in there.
Until you really go in there, then you really know. And it's interesting to see a cavity. You start comparing some of these. You're like, that's nothing. You get in that tooth. Oh, jeez.
Really?
The thing was huge.
Oh, wow.
But then you know that. That's how that patient exhibits their cavities. And that's what it's going to look like on an X-ray. Whereas the other person, oh, that was small. Okay.
Yeah.
I thought it was going to, I thought this might be a little bit bigger according to this X-ray. And you get in, you open up the tooth. That wasn't as bad as I thought it was going to be.
Yeah.
And that happens.
Really?
So that's the other thing that if you have a rapport with your dentist, we have an idea of how you trend and
No,
what are you
100%.
susceptible? Are you
Yeah.
more susceptible to cavities? Are you more susceptible to tartar? There are some patients, and we were talking about X-rays. They were doing every 6 months because they were just doing like certain spots, but they were doing
Yeah,
really.
no, yeah.
And I will sometimes, if I'm suspicious about something, I will be
And that
taking
could have been it.
I will take an X-ray every 6 months.
Oh, absolutely. And that could have been, I think he was watching a tooth. So I
Exactly.
think that's why he was like, you know what, next time we're going to
Absolutely.
do that. So
Yeah.
that's when,
But really, we
but
do.
I listen to my dentist usually. I mean,
Well, we
except
understand.
for candy sometimes. But no, but like when they say that, you just have to like get the X-ray, just pay for it. It's so much, it's worth it than having like this huge problem.
Well, and yeah, that's the biggest thing. The longer you wait, the bigger it gets, the more expensive it gets, and the painful it gets. So, and that all has to do with the anxiety, and I feel like the loss of control and the fact that when you have something going on with your mouth, it's connected to your head, and the pain level just it seems like it's far worse. It's more
Because it's
intense.
it's all in your face and stuff, and like right
Yeah.
close to your head, and you
Yep.
get these headaches. But the grinding. When we were talking about the grinding, like how many times have I come in, and I'm probably not the only one
No.
because I know I'm not. But
Yes.
like other people come in, and literally, I thought like I'm gonna need like a root canal, like something is majorly wrong with
That's right.
me, and I could have like emergency visit, like there is something wrong with me, and it's from grinding. And
It is amazing.
it is, and it's so crazy because like, and I hate wearing that thing, the
night guard.
I pop it off in the middle of the night. So I
People
find it
do. Like some people like throw it, and I'm like, well,
Yeah.
you're giving it the best try here.
I am. I feel like my husband find it in the bed. I need to get another one too. When I get these teeth fixed, I have to get another one. But like, it's true though. It like my headaches have increased since the dog ate it. So, and that's a huge thing too. And
Mhm.
I also then it's just the wear and tear, and I think like I'm always having trouble on. I guess I must grind to one side too because I'm
We have a preferential side. Like
really.
I will wake up
You
and
catch
I have a
yourself.
night guard, and if I'm not doing what I should be doing.
Exactly.
Oh, I got my jaw right over here.
Oh my gosh. And and then it grinds on those teeth, and then it's not good for the teeth.
It's not good for your teeth. It's not for your gums. The other thing that it's doing, because what's happening is that think your teeth have shock absorbers, right?
Okay.
So just like your car,
okay.
they absorb the shocks, right?
Yeah.
But eventually, if you keep going over huge bumps with your car, you'll wear out those shock absorbers. Well, our shock absorber with our teeth, it's a ligament, and that absorbs a lot of the clenching and the grinding. But if you are just clenching and
Yeah.
grinding and the teeth is getting depressed in that socket, that ligament gets inflamed. And that's when you start getting that pain. And that's when it can start mimicking a tooth that you think that might need a root canal.
Because it really does feel like.
Yeah.
I've never had a root canal. Thank you, Jesus. Please don't ever let me have one. But anyways, that really, the guard really does.
Because it's taking off some of the pressure.
It works, should I say. And
that
I
your
never
teeth
would have thought that.
otherwise. Yep. And
Yeah.
the muscles.
Yeah, and I thought like, okay, because I don't wear it every night. I can go without it. The dog ate it. And no, I can't. Like I've been taking more Excedrin lately because
Of the
and then Motrin, and that's not good for you to take either, constantly taking stuff for
Yeah.
your headaches and stuff. So that's terrible. So anyways, y'all also do crowns,
Yes.
right? Yeah,
Yes.
y'all do crowns, and I guess talk about that a little bit because that's super. Yeah, y'all had to do a crown on me.
So I kind of like to think of a crown
Mhm.
as like a football helmet or a helmet.
Yeah, explain it to me because I'd like to
So,
know about it too.
Because initially you get a cavity, maybe it's on the chewing surface, right? And then because fillings are not going to last forever, nothing lasts forever.
Mhm.
Eventually it's going to wear out. Our mouth is a very, very extreme environment. You get extreme hot, oh, I'm going to have some espresso. And then cold, oh, well, with that espresso, I'm going to have some ice cream. Well, with that espresso,
Yeah.
my teeth are expanding, just like the roads outside, right?
Oh gosh.
And then the cold, they start to contract. Just like out there, if it's snowing outside or it's icing, our roads, they start to contract. So, and then over time on our roads, you start getting those cracks. Contraction, and then expansion. Well, you have the same thing going on with your tooth. When you're eating, then we talked about the clenching and the grinding, that's thousands of pounds of pressure on those teeth. Eventually, that material is going to wear out.
And that's where I have 2 crowns.
Well,
Isn't that
and then
crazy?
you
Where I
replace the
grind.
filling.
Yeah.
Another filling gets placed. It gets larger and larger every time. But the problem is that if the filling is too large, and and especially in the back where we're talking about thousands of pounds of pressure,
Yeah.
the filling will eventually just crumble. And if that filling is very large and it crumbles, sometimes your tooth is not fixable because it will actually break your natural tooth, and the crack will go down the root surface.
Oh wow.
So when your dentist looks at, okay, we got an existing filling here. How large is this thing? Is this thing 50% of the tooth or greater? Then then that's when that conversation with the patient about, okay, you need a crown here. Well, what is that crown really doing? Well, it's like a helmet for the tooth. It's protecting that tooth from breaking. And because if that tooth breaks, it could become not fixable. Now we're talking about another way to repair this, or not even repair, but another solution, a more expensive solution than a crown. You're talking about removing the tooth, doing a bone graft, doing an implant, or removing the tooth and then crowning, putting football helmets on the 2 teeth that are right next to it, and then with this connection piece called a bridge.
Oh wow.
So now you're talking about more expensive options to take care of a crown. So really, crowns are there to protect your tooth from
100%.
further
I never
fraction.
understood. I understood what you were doing, but not really. But that's such a good way, like a helmet on your tooth. That's
Yeah.
such a good, simple way
That's
to understand
really
it.
the best way because like Dr. Fernandez is great at explaining stuff.
You are too.
Well, but I kind of started learning, okay, who knows what this is, right? So we got to really start thinking of some everyday terminology.
Oh yeah, because y'all have like way weird terminology.
And sometimes I forget. Like I'm like, oh gosh, I just said this. I'm like, I mean this.
Yeah.
But I mean, because it's your mouth and it's your health, and at the end of the day, it's where you want to take your dental health. I can only recommend things to you, and if you don't fully understand why we're recommending it, why are you going to even pursue that?
Oh, absolutely.
And you have to be okay with materials that are going in your mouth. I think that's something that there's always a place for every type of medicine and dentistry. So if you're not okay with metal in your mouth, then let's not put metal in your mouth.
Absolutely.
But
Yeah. No.
that, at the end of the day, that's up to you, because it's your health, your mouth. It's not my mouth. It's not,
Yeah.
and I can tell you several recommendations. This is, and that's really our job as a health provider, is to help educate you so you can make the best decisions for you.
No, absolutely. And also, I know like I have a cardiologist, and your teeth has a lot to do with your heart health.
It does. I was a hospital dentist. I did a residency.
Okay.
We worked with services. We worked with cardiology, and we would consult with them. And this was in Mississippi, where we saw just the basic population in any state, where like we said, nobody likes going to the dentist.
No.
It's scary, it's expensive, it's just uncomfortable. And so we saw some teeth that were broken off. And the problem with that is that if you have an active infection going on in your mouth, that the bad bugs that are associated with those teeth, it can correlate with other issues going on with the heart. So if you're going to have heart surgery, you're going to replace a valve, you're going to be, what's going on in the mouth here, all of that bacteria, the inflammation, that's all being circulated through your blood system.
And that's so crazy.
That gets pumped through your heart to go through the rest of your body. So
this is so important.
And
your mouth is so important.
And it is, because if you do have, and I say an active infection, meaning I have an abscess. So I have a golf ball right here. Well, if I have a golf ball, which we saw a lot, you see a lot of that in residency. I've seen it working a lot of places. And is this life-threatening? I saw a golf ball right here on a 15-year-old, 16-year-old. And it's like, nope, we are taking this tooth out right away. I'm probably not going to be able to numb you, because the infection is going to block my numbing agent, because of the it's all about the pH. Anyway, but otherwise, if that infection spreads, it's right underneath her eye. There is a possibility that she could lose eyesight.
That is so crazy.
You can lose eyesight. Now, the big thing is that there's several facial planes where the mouth actually connects to the rest of the body. It can go up either to the brain, or it can come down into the actual chest where your heart is. So that's why cardiologists are always trying to make sure what's going on in that mouth of yours.
No, they
like
do,
you get a knee replacement, heart surgery, or valve replacement. You're usually looking at some sort of antibiotic prophylaxis, as in, okay, we want you to be on some antibiotics because, we're stirring up good and bad bacteria.
Everything okay, Dad? Okay. We have a little technical difficulty tonight, so now we're back on.
We're finding now out with we have advanced technology in terms of research and development. We're really finding out that the head is not disconnected from the body.
Well, no, it's so crazy, because that is so true. Like, the cardiologist told me that, like, your teeth and the way you take care of your teeth has a lot to do with your heart. And I was like, oh my gosh, and I'm like, well, I go and that's true. Every 6 months. Do you recommend every 6 months?
I do, because it's just
because
things
you can catch
change.
it. Oh my gosh. Like
Things can change
that.
within a month. It can change within, oh shoot, I just ate an oyster pearl. I mean, that's
Yeah.
actually one of my fears. That breaks your tooth. I mean, and then the next question, is the tooth bruised? Because you can bruise your teeth.
Yeah, I did.
Or is it fractured?
Yeah.
Do you need a root canal? Do you need a crown as a result? Is your tooth no longer fixable? And there are things that sometimes we're not aware of in our mouth that we look in your mouth and we're like, and that's why it's good to go every 6 months, because
You'll
we're
keep an eye on
looking
it.
and we're comparing, just like we were talking about with those x-rays.
Yeah.
We're always looking for changes. What kind of changes are going on? Because nothing in this world is static. We live in a dynamic world. Everything is changing. My joints, my cells on my skin are changing.
Yes.
Stuff in my mouth is changing on a daily basis. So that's what we're looking for. And so, like you said, so it won't be as big of a problem. So it's like, okay, I see that you just chipped this. Are you aware that you chipped this? No. And it's so interesting. Some people will know right away because that tongue will migrate right to that change.
That's what mine does.
And sometimes other people's, it's just, no, it doesn't.
They don't even register.
I'm just like, wow.
Oh, that's so
That's
crazy.
amazing.
It's so funny.
So-
No, that's so true, because you have, and I mean, I'm a freak about going and getting everything to just make, okay, it's my last, okay, just make sure I'm okay. I don't want to have anything wrong. That's my biggest fear. But also, I wanted to ask, like, bad breath, okay?
Good old halitosis.
A good old, so I brush my tongue.
Wonderful.
Okay, I'm a big tongue brusher. Like, I get after it and stuff,
That's good.
and I floss and do all that. But like, some people have terrible. I hate to say that, but like, they do. What causes it? Like,
Well,
is it
it's hygiene. So I can go into Lowe's and I can go into Home Depot. I can go into your good old hardware stores,
Mhm.
and I can walk near an aisle and be like, oh, I smell gum disease. And,
Really?
yeah.
Oh my God, you're so good at it.
I don't know.
So that's
Anybody in
another
the dental-
question I was going to ask.
Like,
Is the gum?
your hygienist
Yeah.
can smell gum disease. We can smell it. It has a distinct smell. And it's just because there's the neglect of cleaning the gums and the teeth. And there's some really, really good old nasty bacteria way down in the deep pockets of their gums. Now, that's not everybody. But in terms of like bad breath, halitosis, a lot of people actually don't floss. People really don't understand what flossing is about. So your toothbrush, which
Yeah, show that's
Mr.
the one.
Harry's,
You can show
Oh,
it.
whoops.
No, take it off because they can't see.
this is awesome. This does everything for you. And it does all of the little Cheerio motions and oscillations that you need. And all you have to do is, this is like a lazy way to brush. It's awesome. You just let it glide. That's all you do. And glide and glide. You don't want to do the seesaw method because then it's destruction
Really?
on the gums and the teeth because it's too much force and everything like that. And it beeps. Boop. Oh, 30 seconds. Let me move over to the other side. And for a full 2 minutes. Now, that's very effective at plaque removal. So that's going to help contribute to good breath.
Okay.
The other thing is, though, unfortunately, they show these computer-generated models as if those bristles are really getting in between the teeth. They don't. That's what the floss is for.
Mm-hmm.
The floss is the only thing that cleans between your teeth.
And I'm picky with my floss.
Well, so am I. I'm right there with you.
Really, I am funny about floss.
I have a specific floss that I want, and that's the one I like. If I can't find it, gotta go somewhere else to go find it.
Yeah, I'm like that. I am. I guess if you do, and I get in my mirror that is like
It's good.
amped up. The
And
one
then
that's
you're
like,
like, oh, I got
I'm
some
like-
plaque over
and I'm
here.
like, oh my God, that's so gross, and I can't. And I'm looking behind, my teeth, and
But I mean, that's the best way to floss.
really, okay,
Mhm.
just really getting in there, and I'm just
In the mirror. I mean,
Yeah.
sometimes I do the lazy way, and I'm sitting in bed, and my poor husband,
I do that too.
I'm sitting, I'm like flossing as we're watching a movie. I'm like, and I have this, I don't know if you want to call it a bad habit. You can say I'm wasteful with floss, but I think I might be a germaphobe. That's what I've been hearing. My dental assistants are telling me I'm a germaphobe. Because I'm like, okay, now with this floss, I'm only going into this tooth once. Because now it has that plaque and bacteria. I'm moving on to another clean piece. And I'm always looking at my floss
Yeah, I
to
do
see,
too.
okay, was there nothing in there or did I take out more stuff? Because sometimes you got to go in there 2 or 3 times to clean out all the stuff in there. Now, another thing is just depending on, as we live longer on this earth, we get wear and tear. You're going to get wear and tear on your joints, everywhere. We talk about that. Well, you get wear and tear with your teeth and your gums, and you get some gum recession and some bone recession. So we get these little triangles in between our teeth. And sometimes the flossing is just not sufficient enough. So you got to go in there with a water pick. And that's kind of like what it does. It's kind of like water blasting out food particles. It gets
So
the
I
big
don't
stuff.
have that. So that you recommend that, huh?
Mhm.
A water pick. I
Yeah.
remember that, Dad. Didn't we have one like back in the 70s? I feel like we had one.
Yeah, we
And
still have them around here.
yeah, I still have them around here. Okay. It would make a big like noise back in the day.
Well, it does have a little bit of a noise.
Yeah, and I used to love it.
Feels good.
It does.
And pressure washing some of my teeth.
Yeah, I was like, making a huge mess.
So it does. Don't get me wrong. It makes a huge mess
Yeah, and
in your bowl, right?
yeah,
In the
I'm
sink.
talking when I was a kid though. But yeah,
Oh.
now I don't have one. I'm gonna get one though after this.
And you don't need an expensive one.
Okay.
And another nice thing to do sometimes if you're having like any gum issues, if you can get one where you can put the water in it and then you can do a little bit of hydrogen peroxide.
Yes.
Very little. That will help soothe any sort of areas of irritation.
Yes.
Or that mouth rinse. I do like mouth rinse, as you guys are finding out. You can put a little bit of mouth rinse in it too with the water. And then that also helps.
No, and you told me that before to put a little bit of
Hydrogen peroxide with water.
Yeah.
So there is something on the market. It's by Colgate. It's like Colgate oral ulcer rinse or something of the sort. And I was looking at it, and I think you're kind of getting the theme with me here.
Yeah.
I was like, $8 for that? And then I start looking at the ingredients. I'm like, this is pretty much water and hydrogen. How much is hydrogen peroxide?
Oh my gosh.
$2.
Really?
But I mean, it's just getting your proportions correctly,
Yeah,
So
absolutely.
I mean, you want majority water with some hydrogen peroxide.
Yeah.
But you cannot rinse with that chronically. That's not good. You only need to do it when you're having irritation in the mouth, like certain ulcers, not all ulcers.
No.
They're
Yeah.
like, oh, I accidentally bit my cheek. This hurts so bad. Well, a little water with some hydrogen peroxide, 3%. Swish it for 60 seconds, spit it out, do it 3 times a day. And that will actually help whiten your teeth a little. A shade or so.
Yeah.
But anyway, so that the water pick, that's gonna help irrigate out those gums.
Yeah.
Flush out those gums where some of that bacteria, food particles are sitting. Because when you have food sitting in your mouth, the bacteria comes in and they're having a heyday. And that's actually what's contributing to that bad breath.
Well, yeah.
And then
the
tongue.
Yeah.
We talked about the tongue. Because
Yes.
think of your tongue kind of like, I think of like maybe a cane field, So, you can hide in August, in September, you can go hide in a cane field.
Absolutely.
Well, that's what happens on our tongue. Kind of think of it as a microscopic cane field. All those good old like microscopic bacteria,
Yeah.
they're sitting there hiding in there. So that's the purpose of that physical debridement. And that's what toothbrush is. It's just physical debridement. So that toothpaste actually is there to give you a nice clean filling, like that cleany mint filling. I'm a big proponent of a toothpaste. I like I said, after Dr. Wilbank was talking about the poison control on the fluoride, I was like, I gotta go look at the back of my toothpaste.
Mm-hmm.
And I was like, okay, well, if swallowed in large amounts, then call poison control. And I'm like, okay, well, if I'm like a kid and I'm sitting on like trying to take down my entire tube of toothpaste, which I don't think would taste too good. Yeah, too much of any good thing is bad for you.
Yeah, absolutely.
And
Yeah.
that's really, and I think that's kind of a legal thing that's why they do that.
Yeah. Yeah.
But I am and different strokes for different folks. I will completely respect somebody that doesn't want fluoride. But now you
Absolutely.
got to look at other sources to help protect your teeth.
No, you're
So
right.
some of that is a toothpaste that has like sodium phosphate in it. That's one of those rebuilding up the minerals in your teeth. Think of the outside of your tooth just like your bones. Your bones are made up of minerals. Our outside of our tooth made up of minerals. So when you start those acid attacks, start depleting away those minerals, and I'm thinking like shoveling away those minerals, you if that if those minerals start getting depleted too much, you start getting a hole. What do we call a hole? A cavity.
Yeah.
Generically, what is a cavity? A hole. Like, oh, you got and I can't think of the moment where we could use a cavity. It's a space,
Hmm.
So when you talk about and when you think about your bones, right?
Yeah.
Just, oh, well, I think I might be getting osteoporosis. Well,
Yeah.
what is osteoporosis? You're losing a lot of minerals in your bone. And then your
Yeah.
bone is at risk for fracture. So what do you start doing? You start taking these supplements, so like calcium, vitamin D, and Dr. Wilbank was talking about the vitamin D and
So
what you need,
important. Oh,
which
yeah.
is, and I thought that was great that she even went into the detail that she did on the
Oh,
vitamin D.
yeah. So good.
But that our bones is kind of similar to your teeth, right?
No,
So we
you're
got to
right.
feed. So what happens with your bones is that you get on osteoporosis medication to help with getting that density back, refilling those minerals, that sort of thing. Well, with our teeth, unfortunately, you come see the dentist and we got to drill out that hole, get everything cleaned
Yeah.
up,
Yeah.
right? And we do a filling.
Yeah.
So, but I mean, that's usually my, my analogy when it comes to what does that mean that you're watching something on the x-ray? Well, I see a little bit of mineral loss.
Because that's what y'all say. I'm watching it. We'll look at it next time when you come in. And sometimes
It's going to stay the same.
it'll be a year and a half. And then it's like, okay, we got to do something. You know what I mean?
Or
of course, or no.
nothing happens.
Or nothing happens. No,
And
exactly.
your body is able, by what you're putting in your mouth. So like the sodium, the phosphates, the calcium.
And that's why you say don't eat the candy.
No.
And the gummies.
The
and
gummy,
all that.
they just sit right there.
Yeah.
And like
you can't
she
get
said,
out.
you shouldn't be eating those good old goldfish. Oh, but stuff like that, it sits
Really?
on your teeth, and it's sugar too.
Is it really? Yeah.
It's sugar. So that's the other thing. Just because it's not I don't eat candy. I don't drink fruit juices.
Mhm.
I don't drink soda pop. Well, what are you eating? Crackers? Are you,
You gotta be
eating
eating something.
chips? Oh, well, yeah. I'm snacking during the day, and well, that stuff just sticky. It sits on your teeth.
It is gross. It does sit in your. It gets
It gets in those little crevices that we were talking about.
No, it does. It
and
really
then
does.
eventually, if it
Causes trouble.
that's going to cause trouble. But anyway, so really, the thing with bad breath is making sure the mouth is nice and clean.
Yeah, because that is such a thing. And also wanted to mention too, like when you go through like physical checks, like you're pregnant. I was telling Dr. Wilbanks that like I never had a cavity until I got pregnant, and that's common. And then now I'm at my the second part of my life. I'm going through menopause, and I feel like, of course, my whole body has changed, but now I'm sure my teeth are changing too, right?
Well,
or not?
what's going to change on your teeth is just going to be wear and tear. But really, what will be changing, and Dr. Wilbanks did, she talked a little bit about this, and rightfully so. It all has to do with the acidity in your mouth and what your salivary gland is producing. So hormones affect.
That's what I'm. Yes.
Hormones affect.
Or lack of hormones.
Or lack of hormones. But regardless, those levels
Mhm.
are going to be affecting what is being produced with your salivary gland.
Okay.
And then how acidic is your saliva being produced by your salivary gland.
Oh, wow.
And you don't really know that until you really start pH testing. And a lot, so really a lot that deals with our teeth has to do with What kind of saliva are we producing? What's in our saliva? What kind of components are in it? That plays a role in that. So, for example, we're gonna kind of go off the beaten path here.
Okay.
There's been research shown that people, and I did a lot of my schooling in the Midwest. I'm from the Midwest. We had a huge meth problem in Nebraska because you got those methane tanks out on the farms. So you know what you do? You go out on a farm at night, steal some methane, and then you start making the meth. Well, what they have found is that the meth actually causes the salivary glands, and I'm doing this generically. We're not going to go down into the chemistry of it, but it actually shuts the salivary glands not down, but it down regulates them so they produce less saliva. And then as a result of the drug, you start because you won't eat for days, and you just start craving sugar. So you start drinking these sugary drinks. So between the combination of sugary drinks and a dry mouth, your mouth just becomes a cavity bomb. So very similarly. So let's kind of now. So that's an extreme example.
Oh, I'm sorry. Is it? Oh, my mom's asking a question. Is it recommended to use the water pick daily?
Oh, well, yeah, absolutely. I would do it in the evening so you can go flush your gums out and get all those good old food particles out. And the water pick, kind of think of it like you're massaging your gums.
Yeah. Okay. That's mom again. That was the same one.
Yeah, I mean, I kind of don't blame her. Let's get off that depressing meth topic.
Oh, the meth. Talk about no, but that was like.
But I was just gonna say,
no, it's like the hormones and stuff.
Yeah,
with your
and
mouth
so
being so.
that can, I haven't seen the research behind it.
Okay.
But I can, and I'm sure it is out there. But you start, like I said, the hormones play a huge role in regulating our body. And I'm not an endocrinologist, but we start seeing that the salivary glands start producing less saliva.
Yeah, I mean,
And
everything changes.
Everything's
and
changing.
it does.
And then when you have that drier mouth,
that's when the
stuff
problem
sits.
Yeah, and that's when it happens. That's
when your mouth starts changing.
Oh
You're
God,
more
yeah.
at risk for cavities. So like your mom was saying, hey, let's use that water pick. Should we use that daily?
Oh yeah.
Well, if you're finding that you have a drier mouth, how are you supposed to flush those food particles away?
You're right.
So then really, if you notice that you have a dry mouth, and now we live in a pharmaceutical age. Remember I was telling you about all this great technology that we have, research and development. A lot of people, I mean, when you're on a handful of medications, and rightfully so, but the problem is, what's the side effect?
I know.
Reduced salivary output.
Nope.
Dry mouth.
You're right. No,
So
you're
then
exactly
really,
right.
if you think about it, that water pick, use it after every meal if you have a dry mouth. Flush out those food particles. Get them out of your mouth. Because otherwise you're looking at a
toxic environment.
Environment.
Yeah, because that's true. Because anytime you get on any type of medicine, it can do that. What did you say? It sounds really
Yes,
bad.
it does. Sugar and no saliva.
Oh, Dad. So I'm sorry. I've been hogging the. Do you have any
sorry.
questions?
Yeah, I'm really sorry.
No, I haven't let him ask one question.
Oh, I was going to just make this comment. I
Yeah.
was going to say that having good rapport with your dentist is really important. Some kind of way, I feel like it's almost even emotionally more important than with your GP. Because when you go to the dentist, you run the risk of having to have some invasive work done, and it's not going to be much fun. So you better trust and like the person that you're working with. I had a dentist a long time ago who I woke his wife up at 3 a.m. and he went to the shop and he took care of my problem that I had
that's a
at
great
3 a.m.
dentist.
And then when he retired from the business, he recommended another dentist. So guess where I'm at? I'm at the dentist he recommended because of that kind of rapport with my dentist.
I think the sad thing is that I don't think I'm going to hear my phone at 3 a.m. But I get up at about 4 or 5 a.m. So, but I mean, like before when you had a house phone, that little puppy rang throughout the house.
No.
So you would wake up to it.
You would.
But I'm I like to go to bed early and I get up early.
Yeah.
So, I mean, you'll hear from me in the morning, no doubt about it. But I'm sorry, Harry.
Not a
You're probably
problem.
like,
but that
that
was an
dentist did
emergency.
not answer at 3 a.m.
Yeah. Mine's a unique story.
Yeah, yours is because I think I remember that. Like mom had to drive you, huh? Or no, you drove yourself. You did drive
Yeah.
yourself.
What happened was I had some sort of infection under a crown, and it was generating gas, which was hot and cold sensitive like crazy.
Mm-hmm.
And after about 2 days of trying to, increasing doses of Tylenol,
You waited too long, Dad.
That's right.
well, I'm a man, so we don't go immediately to anything, right?
And this is why I always like to see Dr. Larson all the time because we just gonna make sure that's not gonna happen.
Yeah.
See, I know these stories.
Yeah, I know. That would scare me too.
So what he had to do was simple. It was just drill a hole through the crown, and it let the gas escape. And
That's
he says,
right.
"You're coming back. We got work to do." but,
Oh my
but he
gosh.
solved the pain problem.
Yeah, that's crazy. But no, you're good at returning calls. Though. You are. You're good at that. So let's just pray that never happens to me.
I'm just letting everybody know. My phone, I'm like,
Girl, I will
I'll
wear it
be-
out if that's happened. I will call you.
you probably need to call my husband. He'll probably answer.
That's so funny.
be
I
like,
would
"What?"
freak out. Would freak out. Well, so here's my last question. What's your favorite thing about being a dentist?
I think my favorite thing about being a dentist, what really attracted the profession to me,
Mm-hmm.
is the fact that we're talking about a rapport.
Mm-hmm.
You get to see, yes, you get to see people, but you get to see families grow up.
Oh yeah, you
And
do.
that is like the true beauty of life.
No, it's and it's so true. And I'm gonna tell you this: anytime I go in there, I hear you with other patients while I'm waiting for my turn. And after I'm getting my teeth cleaned, and you're so compassionate and kind, and you listen and you answer the questions, and sometimes you're talking about. Well, I mean, we tell you about our whole life, and you take the. I mean, we do. We
But-
tell her
But
about.
I find it to be very interesting.
I know, but you walk us to the front, and it's just those are the things that makes me feel comfortable. So thank
Well,
you.
thank
so,
you.
yeah,
I really
no,
appreciate it.
and it makes me, and you take care of Ryan and Lindsay and everybody. Hopefully, we'll get Duty to the dentist soon.
Hey, one step at a time. One step at a time. That's all you can do.
I know, but anyways, well, thank you so much for coming
Thank
tonight.
you.
We
Thank you,
learned a
Dr.
lot.
Larson, so much.
Oh yeah, we learned so much. And next week we have
A mystery guest.
a mystery guest. So we'll see.
It's such a mystery that Honey and Harry aren't even sure who the mystery guest is.
Oh well, honey's gonna figure it out.
Yeah. Well, good night, everybody,
Yes.
and we'll see you next week, hopefully. Thank you again, Dr. Larson. We appreciate
Yes,
it so
thank
much.
you.